Sarcomas are a rare form of cancer found in the bones and soft tissues and often diagnosed in children and young people. Well, now Australian research could lead to earlier detection and a better chance of survival for those diagnosed.
A scan of a sporty teenager shows a tumour on the left hip. It's cancerous and deadly, but it had been unscanned and misdiagnosed as a water polo injury for a year and a half.
It would flare up over a week and then go away for a month or two and then come back. Every single time it hurt, I would go to my GP and she would send me away with a pulled muscle.
Mika's story isn't unusual. Teenagers have lumps and bumps for all sorts of reasons, so the cancer is often diagnosed late, meaning survival rates are low.
Tumours light up like a Christmas tree.
But change is coming. Dr. David Thomas is part of an international team with a new diagnostic tool. It targets patients with a specific genetic indicator.
The most important gene that we understand to date that's linked to sarcomas is the gene TP53. Mutations in that gene cause an increased risk of cancer in carriers of those mutated genes. That causes a syndrome of cancer risk called Lee-Fraumeni syndrome.
Knowing this, Dr. David Thomas began scanning people with Lee-Fraumeni syndrome from head to toe with a full-body MRI. During a decade of clinical trials, he and international colleagues found early-stage cancer often. 1 in 14 people scanned had a sarcoma cancer they didn't know about. The early diagnosis meant doctors were able to operate and remove the cancer before it spread.
The first patient we picked up a tumour in had a tumour of the lumbar musculature at the back of just next to her spine. It was completely asymptomatic. She had no symptoms from it, and because we picked it up, we were able to treat it with curative intent.
It's a program he now wants to see expanded.
At some point, we need to move beyond the medical research environment into clinical practice, and we think the time is due.
Dr. Thomas has a proposal before the Health Department to get annual MRIs for people with Lee-Fraumeni syndrome covered by Medicare. Currently, out-of-pocket expenses for scans are upwards of $800. The proposal is under review and a result is expected within 3 months. July is Sarcoma Awareness Month. Mitch Rice-Bradding lost his younger brother to the cancer. He's now part of a group of advocates calling for federal funding to create a centralised body for both sarcoma patients and researchers.
We have these incredible researchers and clinicians working around the country in the sarcoma sphere. What we're trying to do with the Australian Sarcoma Institute is aggregate all their work into an accessible resource for all patients.
Mika's sarcoma was found in time to be removed by surgery. The 17-year-old is now cancer-free, studying for her Year 12 exams and planning the rest of her life.
It's stressful, but it's definitely fun. Year 12 is the best.
Lucy Murray, SBS World News.